Good morning. This is a very sunny day and a beautiful day. This is Mr. Harris. Today we are going to talk about acoustic neuromas. What is acoustic neuroma? Acoustic neuromas are officially called vestibular schwannoma. They are benign and non-cancerous, usually slow-growing tumors that form along the branches by the eighth cranial nerve. This nerve leads from the inner ear to the brain and branches into divisions that play important roles in both hearing and balance. Acoustic neuroma arise from Schwann cells, which wrap around and support nerve fibers. Hence the official name vestibular schwannoma. Schwannomas can occur on any cranial and peripheral nerve in the body, but in the brain, acoustic neuromas are the most common schwannomas. Acoustic neuroma typically begin growing where the central nerve system transitions into the peripheral nerve system. What is the incidence rate? They affect men and women equally and most frequently develop in people while in the 40s and 50s. These tumors are much less common in children, but present in children, they are often associated with a genetic disorder called neurofibromatosis type 2, NF2. What are acoustic neuroma symptoms? The most common symptom is one-sided hearing loss. Over 90% of people with acoustic neuromas develop some degree of one-sided unilateral hearing loss. People with this kind of hearing loss may have difficulty hearing speeches in noisy environment or locating where a sound is coming from. If a person tends to hold a phone to a certain ear or has a hard time following conversation in a crowded room, then these may be signs of hearing loss. The hearing loss usually gets worse over the years, may lead to total deafness in one ear. In some people, about 5% of patients, hearing loss may develop suddenly. The loss may be partial or total, and spontaneous recovery is possible. Sudden hearing loss may be the first event that leads to a diagnosis, or it may occur months or years before the tumor is discovered. Hearing loss may occur from compression or infiltration of the tumor on the hearing nerve, or from substances toxic to hearing. It can affect the hearing range of sounds, as well as the clarity of sound. However, please note that hearing loss may also occur because of aging, even if the tumor is not existing. Some people may feel a symptom of ear fullness, may have a sensation of fullness in the ear as if water is in it. Other people may feel ear ringing, noise in the ear, also called tinnitus. Tinnitus is a very common symptom of acoustic neuromas and many other inner ear conditions. People with acoustic neuroma may experience a high-pitched tone in the ear affected by a tumor. In other cases, the tinnitus can sound like hissing, buzzing, or ringing, or roaring, like shh, or like When most patients with acoustic neuromas have both tinnitus and hearing loss in one ear, some may experience tinnitus without hearing loss. Tinnitus can come and go or be constant. Other folks with acoustic neuromas may experience balance problems and vertigo because acoustic neuromas arise from the vestibular nerve responsible for balance. Unsteadiness or balance problem may be early symptoms for acoustic neuromas. Nearly half of people with acoustic neuromas notice these symptoms, which tend to be worse if the tumor grows. Large acoustic neuromas may compress parts of the cerebellum, which may lead to falls. Patients tend to fall toward the side of the tumor. The balance system can compensate for the loss of balance, so it may stabilize. True vertigo. The sensation of spinning or tilting is not commonly associated with acoustic neuromas, but it can sometimes occur due to tumor growth or bleeding. There are other signs of acoustic neuroma. Acoustic neuromas can also put pressure on other important cranial nerves that are adjacent to where these tumors grow. For example, numbness in the face can result from a tumor pressing on the trigeminal nerve. There may be ongoing or periodic numbness and facial tingling on the side of acoustic neuromas. There may also be eye irritation or redness due to numbness in the eye that prevents appropriate blink reflex. Second, facial twitching or weakness can result from the tumor pressing on the facial nerve. This can cause twitching of the eye, eyebrow, forehead, or mouth muscles. As often, you may notice weakness in the face. Facial weakness often does not occur until acoustic tumors grow quite large, and it is less common at the time of diagnosis. Third, swallowing problem can occur from the tumor pressing on the vagal and the hypoglossal nerves. These nerves control several aspects important to swallowing, including sensation in the throat and movement of vocal cords and the tongue. Changing taste and tear production is a less common symptom, but it should be evaluated by a doctor. The facial nerve helps control taste and tear production. Pressure on the nerve can cause dry eye or even unexpected tears, as well as changes in taste perception. Last one, headache and pressure. As acoustic tumor grows, they can press on the lining of the inside of the skull, the dura. The dura has sensory fibers that can transmit the sensation of pressure. The headache that results from acoustic neuroma can be dull or itching, and it is usually on the one side of the head. The pain may be related to the neck or the top or front of the head. If you have more than a few of these symptoms, especially if they don't go away or become worse, your doctor can help you decide whether more testing is necessary. Serious complications of acoustic neuromas may exist. If untreated, acoustic neuroma can grow large enough to cause pressure on the brain stem. The tumor can block the flow of cerebrospinal fluid between the brain and the spinal cord, causing a buildup of the fluid in the brain. Because the skull is a closed structure, excess fluid in the brain can press against the brain, causing unsteady movement and lack of coordination, headaches, and confusion. Okay, so far so good. Let's continue to talk about what acoustic neuroma diagnosis is. Because symptoms of these tumors resemble those of other middle and inner ear conditions, they may be difficult to diagnose. Diagnosis usually starts with an ear examination, a hearing test, and imaging. Based on the symptoms, your doctor may help determine if you need a computerized tomography, a magnetic resonance image, CT, and MRI. MRI is much more sensitive than CT for detecting acoustic neuromas. If your doctor is concerned that you might have this tumor, MRI is the preferred test. Early diagnosis offers the best opportunity for successful treatment. Let us look at each test in details. First one is a hearing test, audiometry. This is a test of hearing function that measures how well you hear sound and speech. It is usually the first test performed to diagnose acoustic neuroma. A doctor asks you to listen to sounds and speech while you are wearing earphones attached to a machine that record responses and measure hearing function. If you have acoustic neuroma, your audiogram may show the following. The audiogram, the result of the hearing test. First, increase the pure tone threshold. This metric evaluates how loud a sound frequency needs to be before you hear it. Second, increase the speech reception threshold. This metric evaluates how loud speech needs to be before you hear it. Similar to pure tone threshold, the higher the score, the worse the hearing. Third, decrease speech discrimination. This metric evaluates how many words you can detect, 1 year at a time. The doctor will play a few confusing words and let you choose which one you just hear. The lower the score, the worse the hearing. Fourth, MRI image scan of the head. If other tests point to a possibility of acoustic neuroma, MRI can confirm the diagnosis. MRI with a contrast dye can help pinpoint the tumor. If acoustic neuroma is present, it will soak up more dye than normal brain tissues appear clearly on the scan. In short, MRI commonly shows a densely enhancing bright tumor in the internal auditory canal. Wow, really sunny day. Temperature now rises up. I feel warm, and not many people here in the park. It's really quiet. I guess the sound pressure level here of the noise is about maybe, I would say 40 to 50 dB SPL. So pretty quiet and very calming, relaxing. Okay, let's come back to the topic. Let's talk about a question. Are acoustic neuromas dangerous? In summary, many acoustic neuromas do not grow, and though not always, most that do grow tend to do so slowly. They typically do not invade and destroy tissues like cancerous tumors do. However, they can cause symptoms as they grow and push on important surrounding structures. Even if acoustic neuroma is not growing, it can cause worsening hearing loss, balance function, and other issues. If acoustic neuroma is left untreated, it can cause a dangerous buildup of fluid in the brain, or it can compress the cerebellum and brainstem, which can be life-threatening. This is rare for patients whose tumors are properly diagnosed and treated. So, what is acoustic neuroma survival rate? Though acoustic neuromas can cause lasting problems, death from these tumors is rare if they are properly diagnosed and treated. What are different types of acoustic neuromas? There are two major types of acoustic neuromas. First is sporadic unilateral acoustic neuromas. These tumors only grow on one side of the body in 95% of patients. They occur from sudden, non-hereditary mutations. These unilateral acoustic neuromas may develop at any age, but most commonly occur in people between the ages of 30 and 60. Secondly, genetic bilateral acoustic neuromas. Acoustic neuromas on both sides of the body only occur in people who have a genetic disorder, neurofibromatosis type 2, NF2, a mutation in chromosome 22 that affects the gene responsible for production of Schwann cells. These patients often have other schwannoma-like tumors throughout the body, and treatments for these tumors are often different from treatment for unilateral tumors. Okay, this is today's topic in regard to acoustic neuromas. Thank you for listening. I hope you have a very healthy hearing and a very happy life. This is Mr. Harris. Thank you very much for watching. If you like the video, please feel free to subscribe or like. Your support is motivating me a lot. Thank you very much. Bye-bye.